It's Lindsay McLeod Garcia. I'm doing my second clinical update with my population at risk of teenagers. My objectives for this are to educate on holistic approaches to depression, as well as the traditional treatments, creating an interdisciplinary care plan to help with management of depression symptoms. Before you go further into this presentation, go ahead and take the pretest and see what you know. And then at the end, you can take it again to see how much you've learned. So what is depression? Depression is a disease that affects your normal day-to-day tasks. Those include eating, sleeping, homework, interacting with others. And it's important to know that these symptoms often start in your teens. 13% of teenagers have a diagnosis of depression. It's not something that you should see as a sign of weakness or as something is wrong with you as a person. It is a disease just like arthritis, heart disease, and there needs to be treatment for it. So what should you watch for? With depression, there's a feeling of sadness. You feel anxious or empty inside. You might feel hopeless and that nothing is right. You might feel like you are worthless or feel guilty. You're irritable all the time. You withdraw from your friends and things that you normally like. You might see that your grades drop. You're eating or sleeping more or less than normal. You're always tired. Your energy is low. On the other side, you might be restless and unable to sit still. You have trouble concentrating and making decisions. You might notice that you're having headaches, stomach cramps, things that you don't have a known cause for. And then there also might be thoughts of dying or suicide and wanting to hurt yourself. So the treatment for depression is often a combination of different things to make it successful. The first thing is psychotherapy. There's medications and holistic approaches. In the following slides, we'll go over different things for those three treatments. So talk therapy or psychotherapy is the first modality we'll look at for treatment. Like I said, this is where you talk to someone. You learn how to manage your behaviors, thoughts, and emotions. They can help you learn coping mechanisms. You really just find support and someone that you can talk to. It can be done one-on-one or with a group. Your family can be included to help provide support, and then they can also learn how to help. It's important to learn skills. We're not born knowing how to manage our emotions all the time, and it's important to talk to somebody that can help with those things. Another thing that might be done is you might be prescribed medications by your doctor. It's important to take them as they're ordered, and it can take a few weeks to feel like they're working. They don't work instantly, but if you do have increased depression or thoughts of harming yourself in any way, you do need to let your doctor know. There are side effects that you should also discuss with your doctor, and never just stop taking your medications without talking to your physician first. There are some holistic approaches you can do in conjunction with the others, with the medication and the talk therapy. Spend some time outside. Find an exercise routine you like. Walk with someone. Set a sleep schedule. Set a daily routine that you know you're going to go to bed at this time and get up at this time. Break up tasks into smaller, more manageable projects if they're overwhelming. And spend time with friends and family. I know it's really difficult right now with everything that's going on, but you can FaceTime, you can text, you can call, share memes. There's different things to try to connect with other people. Suicide prevention interventions include do not leave the person alone. If you know that someone is saying they're going to harm themselves or they want to, it's important to stay with them. Don't promise to keep it a secret. Someone needs to know. Get help and call 911 if you need to. You can use social media and community outreach programs for help. You can use words like suicide prevention, and self-harm on social media platforms, Twitter, Facebook, Instagrams, and it will help you find resources and support groups. The National Suicide Prevention Lifeline is open 24/7 and is confidential. You call 1-800-273-TALK and it will connect you to someone. You can text HOME to 741-741 for the crisis text line, and they can connect you to a mental health professional right away. It's important to get help. People want to be supportive. They don't want anything to happen to you. And it's important to know that and remember that you can't get mad at someone, and don't worry about someone getting mad at you if you do tell someone and try to get help. In conclusion, it's important to remember that depression is a disease that needs treatment. We are really in uncertain times. It's not a sign of weakness. It is a sign of your health. It's important, just like any other disease that needs treatment. Using multiple ways of treatment helps make it successful. Talk to someone, holistic approaches, use medications. They're there for a reason. People want to help. Get help if you feel suicidal or know someone that is. Every life is worth saving, and it's important to talk about these things. Again, it happens in 13% of teenagers, and it's more people have it than you know. And it's not something that's taboo. It's something that is real and important. So looking at care planning, interdisciplinary for depression, the problem is feelings of hopelessness related to social isolation, chronic stress. It can be seen in changes in sleep pattern, a decrease in appetite, apathetic mood, poor participation in daily care, and passive interactions with others. The goal is to improve quality of life, which will show improved sleep patterns, improved appetite, and expression of emotions to others. For an interdisciplinary team interventions, you want to have the okay from the patient to talk to the family, if it's okay, to talk about the symptoms and what they are seeing to help with treatment. Help develop positive expectations for the teen and others. Talk about goals that they have in their life, long and short. Encourage to get 9 to 10 hours of sleep for a teenager. Use empathy when talking. Try to understand what they're saying and their feelings. Help with setting up physical activities they like. Help them focus on their strengths so that they can use that with problem solving. Use social services to give outside resources and referrals. Help the family learn how to support the patient. Look at cultural beliefs and norms. Are there gender differences, gender identifications that need help? Encourage the patient to find self-help groups and enlist their peers to talk. Set up online social networks to help with socialization and encourage them to keep a daily routine. Educate on medications that they may be prescribed by their doctor. The care plan for suicide prevention. The problem is a risk for suicide related to loneliness, change in mood, risk detection, expressions of wanting to die or hurt themselves. And the goal, of course, is to have no self-harm, maintain self-control, and talk about feelings appropriately. So what interventions can be done for the suicide care plan as an interdisciplinary team? You assess for the suicidal ideation. Look at their history. Is there a history of eating disorders, stressful life events, self-mutilation, family history? Help set up a no suicide contract. Talk about their feelings. Explain the responsibility of safety. Watch for warning signs. Making statements, giving away possessions, reckless behaviors. Talk to family members and educate them. Talk about suicidal thoughts. How often do they think about it? Do they have a plan and a way to harm themselves? Do not make promises. Help guide the patient, provide positive support, provide education on suicide, refer for mental health counseling, hospitalization if needed, needing one-to-one supervision, help with medication use, find support groups and networks to connect, help with family-oriented crisis interventions, and assess their school and peer for bullying, and you might need to use the school nurse to assist with outside services.